So it's interesting how the holistic community kind of we find each other. And it's interesting to me because you have Dr. Loomer now working with you, and she has worked with Dr. Jean Dodds before. And so this community we kind of seek each other out because it's a small community, but it's so needed. It's so needed. We just don't have it. I keep saying I thought in Orange County we would have more access to this kind of stuff, but you guys are pretty much the only. I've been to your facility and I've been to another facility a while back, and your place is the only place like it in Orange County. I guarantee it. I guarantee it.
It is.
It is. It's absolutely amazing. And the group of people that you're pulling together, the team that you have, is just fabulous. I was very excited when I found out some of the doctors that you have on there. So walk us through a little bit how it would work if we have what was the big need, right? Your dog had knee surgery, but what about all of the other purposes that I know? I'm just going to back up and tell you, I brought my dog there and she doesn't have any medical problems. So show us the variation of things that people could use in your facility.
Yeah, so we do. So as far as, the swimming pool's kind of, I always like to say it's the star of the show because it's really what's unique to the animal wellness. So we swim, every type of dog. It could be a young, healthy puppy that wants to come in here and just burn some energy, to a dog that's paralyzed. It could be a dog that's, a senior dog that's arthritic, a dog that's overweight, maybe an older dog that is not a great candidate for surgery. So, the water is so healing. Our pool is warm. They're weightless in the water, so there's no stress on their joints. So, pretty much every type of condition, dogs that are recovering from spinal surgery, and there's Dr. Voulgaris joining me in the back. You can come. I know we're kind of in the.
Hi, how are you?
Voulgaris. Hi. And so she just joined us a couple of weeks ago, so we're super happy to have her here. Sorry, we're trying to adjust this. Yeah. And besides the swimming pool, so we also do acupuncture, chiropractic. Dr. Voulgaris is bringing to the facility like ozone therapy. Maybe you can talk about some of the therapies that you're bringing to the facility.
Yeah. So I do ozone therapy. It's an oxygen therapy. And basically it's oxygen that goes through a generator and creates ozone, which is 3 atoms of oxygen that are brought together in a molecule. And it's been shown to have amazing effects on the body. It's great for the immune system. It fights infections. It's used as an adjunct for cancer. There's been a lot of research on it, and it's very gentle. It's about as gentle as it gets. It's oxygen.
Yeah.
And it's easily administered. So it's something that we use, where you can use it for pain management and inflammation and all kinds of things. So
that's so amazing. We use ozone baths at my place, and so I've been doing ozone baths for a while, and the difference is night and day. So I've been reading a lot about the health benefits, both internal and external. So it's just nice to see more places. I actually haven't met you, Dr. Voulgaris. My name's Carrie. So I'm
nice to meet you, Carrie.
I know she's coming in hot. She literally was just finishing up with a patient. So.
Coming in hot. It's awesome. But I have met Lourdes and Barb, and I know their passion, and I know that they wouldn't bring in doctors that weren't absolutely amazing. So when I heard that you were joining this team, I quickly looked up and found out you also do a podcast, right?
I do. I started it, with the COVID thing. I think, there were a number of people. I wanted to start to get on there and try to get information out on a larger platform.
Yeah.
So from a holistic point of view, we see things here all the time, and just, throughout our careers with animals, we see things all the time, nutrition and, over medication and over vaccinations. And, I think that the pet parents that we work with, they want so much to know information.
Right.
They're willing to do anything to help their dogs, cats, horses, whatever animals they have. And it's a matter of education.
Yeah.
And so, that's what I'm trying to do.
Yeah. No, yeah. just so you guys know, when I'm looking down, I'm looking for any questions that might come across for you guys, so you don't have to be staring at your screen, so we can answer them. Lori is also behind the scenes. She will type in any information when you guys are talking, and for our listeners, when you're listening, we have somebody behind the scenes that will type in any information. So really quick, Dr. Voulgaris, how, other than obviously they can reach you here at the Wellness Center, but the Wellness Center doesn't do lab work, correct?
No, not really.
Yeah,
Right.
we're not doing, so we want to work in conjunction with our patient's primary veterinarian. So,
Right.
for blood draws, x-rays, anything like that, we work with them. So
Right. I want to make that
Right.
well, I want to make it clear as how this would work is that if your animal needed some kind of treatment in this center, they would have to first start with a trip to their veterinarian, correct?
Yes, but any patient that comes through our door has to be evaluated by one of our veterinarians just to make sure that
Sure.
the proper treatment. So we call and get medical records. So if somebody calls us, just to kind of walk you through it, somebody calls us and they want to book an appointment, we usually ask, what's the condition, what's going on, and then we'll call and get medical records. The doctors will review that before the patient's appointment, and then once they get here, based on their assessment and their findings and the medical records, and they'll propose, what they feel is the best treatment for that particular patient.
Okay. Well, that makes sense. Obviously, one doctor can't treat an animal that they're not going to do an exam on. so, but you're not going to be doing the surgery there necessarily, right? So a lot of this is going to be post-operative type of treatments that we might be doing, to heal through ozone therapy and, talking about. Dr. Voulgaris, it sounds like you're very interested in nutrition, and I heard you mention don't over-vaccinate. So I think I almost fell out of my chair when you said that, of happiness. So
and I'm not an anti-vaxxer. I mean,
neither am I.
Vaccines are very important, and I think it's a very sad thing when an animal dies of parvo because they didn't have their vaccine. Right. I mean, I'm all for the science behind vaccines, but I think we don't get vaccinated every year. We don't get vaccinated every 3 years.
Right.
Very hard. It's not benign. And I've seen some very bad things happen, and it's unfortunate. And I know that there are a lot of people, not to get political, I'm not going to get political, but there are a lot of doctors out there that are trying to make legislation a little bit different so that, it's case by case, it's more reasonable. We do it if we need to. Not if we don't, there are people that are vaccinating 20-year-old cats in their house that never go outside for things like feline leukemia, and it's just, it's not great for them.
Yeah.
So,
No, I agree. It's really a case by case. I also never want to get political, or everybody has their own views. But for me, I don't like being called an anti-vaxxer. I know there are people who are anti-vaxxers, and that's their choice, and that's great. But for me, I'm not. I have seen dogs die from parvo, so it's very different. And so it's nice to hear someone use the term over-vaccination, because that is the case. You get a 20-year-old cat who never leaves the house, who's getting a leukemia vaccine and has, stage 4 kidney failure. It baffles my mind a little bit. So it sounds like you're going to be an amazing, I've met with Lourdes a lot, and we've talked on the phone a lot. So it sounds like you guys are just this perfect little.
I mean, I knew about them, and I came down to meet them because I knew about it, and I had a feeling that it was the type of healing space that I was hoping to be a part of. And when I got here, I could feel it. I met Barb and Lourdes, and it just felt really right and good. And so,
And we were excited when I saw her message. I was like, oh my God,
Barb! Now, Lourdes, was Dr. Voulgaris at the place that you had originally gone to with your dog?
No, but she actually went at a place next door to the place that I originally went to. Right?
It's a small community. Yeah. It's definitely a small community.
It is.
Yeah. So, I mean, I've been in rehab and integrative medicine for a while. I've been doing this. I mean, I came to California after a residency in Knoxville, Tennessee. And yeah, so it's like I have to get to California. And so then I went right into rehab, a place that was in that area. And so that's how it all started for me. And then I've been doing rehab and integrative medicine for over a decade now.
That's amazing. That's amazing. Yeah. We just don't have enough, I think, of like I've told Lourdes and Barb. Hi, welcome.
Hi. Sorry, Judy called.
No, we get it. But what we've been talking a lot about is the lack of this. And I told Lourdes the first time I met you, Lourdes, you're going to need to get another pool, and you're going to need to get bigger. And sadly, that's because there's such a need for it. And we don't have enough veterinarians and enough people like Lourdes and Barb who recognize that need, who are putting in the effort. But I agree with you. The first time I walked into your facility, Lourdes, when I first walked in there, I thought, wow, it's just such a healing space. It's just such a warm, healing space. And you can feel that energy when you walk in there.
And so can the animals.
That's exactly how it happens, right? And I tell people that all the time. Animals you can get a pack of wolves, and one can just raise its ear, and the whole rest of the pack will be alert. And that's without making a sound, and that's energy. And so if we don't think that our animals can pass down energy, or we can pass energy down to our animals, we're not paying attention. So I love the space that you work within. It is such a calming.
That was what we wanted to create. We always said we wanted to make it feel like you were walking into a spa. We wanted it to smell good. We wanted it to look nice.
Yeah.
And we have, so many, I hear this all the time, which is so cool. Like people that come in and like, oh my God, my dog is so they're so calm here. Like they're not like this anywhere else. And oh my God, they love you. They're so, all the time we hear this, and it makes us feel so good that, that we created this space and
they feel it too.
Yeah.
Yeah. So I have, for the listeners know, I run a doggy daycare, and one of my clients has been coming to you, and it was so amazing because she came in the other day. Neither one of us knew she had been going to you. I didn't know she was going to you, and she didn't know that I knew who you were. And she came in bragging about this new place down in, that she's been taking Pepper, who's this little tiny dappled dachshund, to go swimming. And I said, oh no, I know, I'm going to get in that pool with Pepper one of these days. I've known Pepper since she was a baby. So I love that the community is starting to branch out and understand, even though Orange County, in my opinion, does not have enough truly holistic or homeopathic veterinarians. I wish we had. It is happening, and we're starting to branch out a little bit, and people are recognizing the changes in their animals. So I commend you too for not being a part of the animal world and being able to put such, like, on your first try, like, boom, here it is. We're just going to put this place up and it's going to be great. And I just think I'm very impressed because it took me a long time to get to where I am, and I had to keep changing things. And I feel like you guys nailed it on your first try, which is.
Oh, well, thank you. I think we said before, like, if somebody would have told us like everything that we would have had to go through and that it was going to take as long as it did, we probably, I don't know. If I didn't have Barb, if we didn't have each other, if I was doing it by myself, I definitely would have probably never had the guts to do it.
Yeah.
So, having us do it together and starting the journey together, definitely keeping us accountable. Barb kept us accountable. I remember in the beginning, she was like, okay, we're going to meet every Monday. We're going to talk about our next steps, and we're going to go write a business plan. And
very good.
I need a Barb. I need a Barb because I'm the like.
We all need a Barb.
Yeah.
I love to do because I like to get, let's do this, and then I fizzle out sometimes, and I'm like, I don't know. Like when I decided to do a podcast, I had never even heard a podcast. Somebody said you should do a podcast, and I remember I had like this piece of paper, and I thought I had to follow all these directions, like read this, and it was a train wreck, and I almost walked, but my love for animals.
Yeah, you did.
Well, my background's actually in speech and debate. I competed in college for 4 years, and so it kind of made sense to start talking about something I love instead of just talking. So
right.
it kind of made sense. And then I've been able to meet so many people like this because for so many years I thought I was just the only, I don't want to call you guys nutcases, but I thought I was the only nutcase. And so it's so great to find out that there are really so many of us that understand. So let's talk a little bit about some stories. I'm a storyteller. I love to hear stories. So why don't you guys pick one of your favorite healing stories through, it can be through anything, through ozone, through nutrition, through the pool. Just share a story with us.
Yeah, I mean, I can share some stories about the pool. I mean, there's so many, and I don't want to say that I have my favorites, but I mean, because I love them all, especially the ones that come to us that have, you know, some issues. I mean, I could talk about Speedy Petey. He was a rescue dog from Mexico. And
Wait. Speedy Petey?
Speedy Petey. He has his own Instagram page. I think it's Speedy Petey. There's a Speedy Petey, and there's also, I'm sorry, wait a second. Speedy. There's a Speedy. There's the dark hair Speedy, and there's Speedy Petey. So both of them I love. And both of them were actually rescue dogs from Mexico. They were both hit by a car. And Speedy, who actually went to his foster family about 2 months ago, he lives in San Diego now. He was coming here, and he has these amazing foster parents. They're incredible. And they would bring him here, and they'd come swimming, you know, twice a week. And in the beginning, you know, there was no movements in his legs at all. And we had a life vest on him. I had a neck ring on him. And we would swim him that way. And then I would work his legs in the water. And as time went on, maybe like, I don't know, a month into it, I'm like, let's just try taking off the life vest and see if he can keep himself up. So, you know, he kept himself up. He was building his core. And then up until the day that he left here, you can probably go to our Instagram page and find, you know, videos of him, but you can actually see his legs moving in the water now. And then when we get him out of the pool, we have him stand, you know, he could stand for, you know, 15, 20 seconds or so. So, I mean, that's just one amazing story. I mean, is he ever going to run and walk like a normal dog? Probably not. But the fact that he was getting, you know, moving his legs in the water and being able to stand. And now he's with this amazing family in San Diego. And I keep begging them. I'm like, please bring him. Please bring him so I can swim him. I want to see him. I just love his spirit and his tenacity. And he was just, you know, he was a fun dog to swim. I mean, there's so many. And then there's Bay is a dog that started swimming here a couple of months ago. She has cerebellar hypoplasia. And she loves it. She loves to swim. And I mean, we swim her with the life jacket because she needs to be stabilized. But now she's swimming so good that we're just kind of like lightly lifting her, and she can, you know, kind of balance herself in the water. So, and then there's Speedy Petey, Eddie. Oh my God, there's so many. But yeah, it's just, you know, it's great. And what I love about this business is all the amazing pet parents that we meet, you know, that want to take care of their animals.
Yeah. They do more for their animals than they do for themselves. And there's so many people that you talk to. I mean, I ask this to people all the time, and I'm like, so when was the last time you had acupuncture as an acupuncture for a dog? And they look at me, they go, I've never had it.
Yeah. Wow.
Wow, like in your whole life, you haven't done this for yourself. And these are sometimes people that are having trouble with their back. They're having trouble with something that acupuncture could certainly help with. And they're not doing it for themselves, but they are doing it for their dog.
Yeah.
That's amazing.
Yeah.
It really is. You know, it's one of the reasons why not to get off subject, but I'm involved in another organization called Joey's Legacy, who's fighting to change the laws that our pets are not property, that they are companion animals, and we need to change those laws. And that is the reason right there that they are not property. We're paying for stuff to make them more comfortable, like acupuncture and wellness, is not because I wouldn't do that for my toaster. Like, I'm not going to be like, oh, the toaster's broke. Somebody quick, spend thousands of dollars to save the toaster. Right. So, you know, and this is, they just bring us so much. This is why this place needs to exist. I'm concerned about Speedy, though. I got to tell you, because I can't stop thinking of Speedy. First off, I need to know, how did Speedy get his name? Do you know?
Because he's fast. He's just like Speedy. Well, there's he's fast, and then Speedy Petey, who's also super fast, and they both have their own Instagram page. It's Speedy Petey on wheels, and gosh, and what's Speedy?
It's so amazing.
I can't remember now Speedy, but it's a dark hair Speedy and a blonde Speedy.
So Speedy's in San Diego. Does he have a pool in San Diego?
No, but I know that there was a pool out there that they were taking him to somebody's home. And then I had seen him recently swimming. He had a life vest on, and he was on a paddleboard with his dad. And which I was like, oh, that's so cute. And then they had a video of him swimming, I think in Mission Lake or something like that in San Diego. So yeah.
Barb, I think you need to start having Monday meetings again. I think Speedy needs a place down in San Diego.
Right?
That's hard. That makes me sad. That's why I think that places like yours should be available all over, because of these kind of situations. You get somebody like Speedy who's doing so well, and then he moves down to San Diego, and oh, poor Speedy.
Yeah. Well, I keep texting them. I'm like, bring him, please bring him. I'm going to give him a free swim anytime you want to come to Orange County. So we're actually, I think the foster parents and the new parents were going to arrange a meeting so that they'll bring him here to the facility, and then I can see him again.
Oh, bonding. We get so connected in these. People don't think so. You know, we get in our day-to-day working with animals, and sometimes we can get busy. We just witnessed that with both Barb and Dr. Voulgaris running around with your heads cut off. That's typical in this industry. But we still get very attached to these animals. There's still those moments, right, where you go from that state of the body being in stress, and we watch when the animal feels better. And I don't know how human doctors feel, or human people who work with humans, but when animals do it, they just feel better. There's not a pill you can give them that makes them think they feel better, right? There's no there's no placebo. They just, if they're in the pool and suddenly they're walking, there's no placebo involved in there. We couldn't trick them. We couldn't go, listen, mom paid a lot of money, so you better start walking. It's just true. And we know it works because it's on animals, and they just get, and they feel better. So tell us a little bit about, we're going to go into like my dog who used your pool, which is a different thing. But before we get into unhealthy dogs using the pool or animals, tell me how long, like the average dog, let's use a dog who maybe got hit by a car, and let's say he fractured his hip and had surgery. I'm just picking something out of the air. Once he's gone through the surgery and he's ready for rehabilitation, how long does something like that usually take? I know age would play a factor of the dog and his diet, and there's other things, but like, can you give us kind of an idea how long something like that could take?
Want me to answer that?
Yeah.
Oh yeah. You're right. I mean, I think that's very individual. It depends on how much trauma, how healthy they were to begin with. But typically, it's probably about 2 to 3 months. I mean, if we're talking about like multiple pelvic fractures, if we're talking about plates and things like that, a lot of dogs come in here with a TPLO, for example. Okay, so that's another orthopedic issue that we see very commonly, and typically it takes about 8 weeks. So for the first, and we're kind of assessing every 4 weeks or so. Yeah. So we're kind of seeing where we are, what needs to change. We're talking the whole time. If something is working, we want to know that. If something isn't working, we want to know that. But I would say for something like that, probably 2 to 3 months.
Is that on a every other day, once a week, 2 times a week? How often usually?
Well, I would say probably twice a week.
Twice a week.
And then pet parents go home and they have some homework to do also.
Yeah.
So, there are some exercises and there are some modifications to the house maybe, and certain things that they have to do. We're not running around, we're not jumping around, we're controlling their movements. So, and diet is always a part of the conversation, because it can either help you or not help you so much. And we're always trying to get inflammation down naturally if we can. And so there's a whole bunch of things that need to be done, or we at least want to try and get done if possible. And so that's going to take a couple of months. That's a pretty severe issue if we're looking at something like that.
Yeah.
You know, and some of the dogs that come in here, or the cats, or any animal that can walk through the
We
door.
had a bunny. We had
Did
our
you
first
swim a bunny?
Aw.
No, yeah, Bunny was here for acupuncture.
Oh, I was trying to picture a rabbit swimming.
Yeah.
Oh, that would be interesting.
Yeah.
Have you, what about the cats? Do they, when we go back to the pool, have you swam cats before? Is that?
No, not yet. Not yet. We've had a couple of cats on the pool deck.
Yeah.
I'm just checking it out, but you know,
I do a lot of bathing of cats at my cat part of my business, and I'm going to just tell you, I wouldn't recommend it.
yeah.
Somebody's gonna get hurt.
I don't think I would recommend putting a cat in your pool. So, or if you do, you better, wear a face mask, and I don't know. I don't think it'll go too well. So I wanted to give people an idea if they have, a severe injury, what they would be looking at is bringing their dog down for rehabilitation. And I make it very clear, nobody is here to diagnose or tell you that they can cure your pet in 6 weeks or 8 weeks or 6 months. This is just to help people understand about what is available in the way of helping and healing. So a lot of times when we think about rehabilitation, we think about fractures and bones and those kind of things. But what other kind of rehabilitation have you done, like pets? Obviously, we can have a pet lose weight, arthritis. What other kind of things do you guys work with?
We see a lot of neurologic conditions.
Really?
And that's really super, super common. So, a lot of older animals have things like bulging discs, for example. I mean, I think that's probably a part of the majority of what we're seeing. And a lot of times it's there's multiple things going on. You have a 12-year-old dog, for example, they might have arthritis, they might have bulging discs, they might be having difficulty walking because of orthopedic pain and all of that. But then there's also the neurologic, that part of it, which is making walking and mobility even harder. Then maybe they're wobbling in the back. We call that ataxia. They might have, a little bit of a loss of coordination, balance, and things like that. So a lot of times we're treating more than one thing.
Wow. Yeah. Well, I'm not a veterinarian, but just from my years of inflammation causes so many different problems. And that's why I love when you say first you got to get the inflammation out. We have to work on inflammation. Yeah. And then little piece by piece things start to kind of fall in together. And so that was one of the things I loved about putting, you guys on the podcast and talking about it, was that nutrition is such a beginning stage of everything. And it can be really, really frustrating, I'm sure, for you as a veterinarian to want to heal an animal. Sometimes people just want one piece of the puzzle to fix it, right? Like, okay, so I'll bring him here twice a week and have him swim, but then I'm still going to feed him this food and not do the homework, and we have to work together and understand all of that, right?
Well, I will say that the people that I've met here, I have not had that happen.
That's awesome.
And I mean, it's been noticeable because I've worked in a number of places, and I've had some resistance and, where you kind of have to know, you're not going to push anything. You don't want to, it has to be gentle, and it's through education and acceptance. And so sometimes people come in and they're a little bit afraid of that. They feel that there's a judgment there, and there certainly is not, because there is so much information out there about nutrition, and it's all so overwhelming and confusing to everybody, including veterinarians, by the way.
Yes.
But since I've been here, I have to say, the people for the most part have been super open-minded and willing to do anything.
That's good.
It's really amazing. It's something that has been very noticeable.
I think that Lourdes and Barb know this. I've worked with animals for 37 years. And I think definitely people are starting to become a little more open to what nutrition is. Whereas prior to probably, I would say the last 10 years have been a little bit of a shift where we can start to see how much nutrition can be a part of healing and using this. And nutrition can also be the reason that our pets are in these problems, which is hard for people to understand. And they're hard for people to talk about it because then they think that it's their fault. And so it becomes a huge problem. Yeah, it's not their fault. And I say the same thing to people. Listen, I used to feed my dog pedigree. I I knew what I knew. If you knew the stuff that I did to my animals 37 years ago, you would probably never want to speak to me. So we know what we know, and we change as much as we can, and we do a little bit. If we have to do a little bit, we do a little bit. And like, for example, I would imagine that you would say if you can swim once a week is better than not swimming at all, right? So your prescription may be twice a week, but if you can afford once a week, then we'll work with you and see what we can do. Wow, the lighting just got so good right now on you.
The sun is going.
Yeah.
Wow, look at
Yeah.
no, look at you guys. Just look like you just got all new makeup on.
Oh, awesome.
I'm like, wow, how do you get that lighting?
We're gonna be live again.
Yeah.
Like a wet dog.
So we have it's not a question, but Carrie Phil says nutrition is key to longevity in dogs. Would you guys agree?
Yeah, and the studies show it.
Yeah.
And there's a lot of research, and this is something that I talk to people about all the time, because it really is the basis. It's what you were saying before, it's the basis. And there's so much research that shows that there are certain things that chemically happen with processed foods, the ultra processed, all of that actually leads to chronic illness. And the studies show that about 70% of all the chronic illnesses that we're seeing in our pets are related to an ultra processed diet.
Yeah,
so that's absolutely right. Yeah,
it's just so hard when we've been taught for so many years that what nutrition looks like is what is in the bag on the veterinarian shelf. And I don't blame the veterinarian for it. Trust me.
Right.
Any vet, even those who are selling food that I would absolutely tell my clients to stay away from. I know that, and most vets are younger than me. It seems like I'm getting older, and I keep seeing these like 25-year-old veterinarians, I'm like, and they're selling food that I know they were taught was the best thing. And so I certainly don't blame the veterinarian, but I think as a society, if we are going to always need these wellness places that you guys have, Barb and Lourdes, because my hope is that one day we're not using it simply because the diet put the dog overweight or put the cat overweight or we have inflammation. So that would be my hope, that we get to that point. But we can use nutrition, and so that's why I like the wellness place that you guys put together, because you're incorporating everything, which is so important. So many places will just say, okay, well, here's this part. Like even acupuncture, which I love. I don't think acupuncture works great by itself. Mm-hmm. And then don't you think people start to say acupuncture doesn't work because they didn't do all of the pieces, right?
Right.
Yeah. So go ahead.
I was just going to say that, you have to, it's like if you're giving something that is harming and causing inflammation and causing, sickness, which is ultimately what some of these diets are doing. I could be the best acupuncturist in the world. I could be, I could do a lot of really amazing things that could potentially help, but it's not going to fix anything if the baseline is not, if the nutrition and all of that is not, very good, then we're going to have a really hard time chasing health. So yeah, that does happen sometimes. So
I have a question. This would be for you. Sari says Zoe is always hungry. This is her dog. This is kind of a little bit about nutrition. She's probably wanting to direct at the vet. Zoe's always hungry. Are there any snacks that are okay to give her? She said she stands at the fridge and cries all the time. We kind of went off into a nutrition area. So
wow. Yeah, I'd want to know more about Zoe. I mean, I would want to make sure that everything's okay, because there are certain systemic illnesses that can cause appetites that are ravenous, and you want to make sure that that's okay. And you also want to make sure that the diet is, fresh food if possible, trying to kind of, eliminate or decrease, decreasing and eliminating processed food as much as realistically possible. But I mean, I always tell people, if they're willing to eat vegetables, that's a great thing to start with. Fruits and vegetables, those things can sometimes be pretty easy to incorporate into the diet. If they don't like that, then I would say, there's a lot of, protein treats out there. I would try to stay away from those cookie treats, the high carb treats. Those, I'm sure they're yummy, but there's lots of sugar in there. We want to avoid that if we can. But the more natural, the better. So, some of the dehydrated protein treats or sweet potato treats, fresh vegetables and fruits, I think those are great snacks for dogs.
What do you think about, I'm going to kind of use this question about Zoe to kind of talk a little bit about anxiety. So if we have an animal who maybe she's standing at the refrigerator and she's always wanting snacks, do you think that a dog like that could possibly just be having anxiety or behavioral issues, and possibly the pool, for anxiety? Have you seen people bring in animals who are suffering from anxiety, maybe coming and working out at the pool twice a week? Have you ever seen that work for anxiety?
Yeah, absolutely. Yeah, we have dogs that are, just come and swim them to get some of that anxiety out, get them tired, get them, just like humans, when we're anxious. And I know for myself, like if I'm feeling anxious or stressed, I need to go exercise, and it's a world of difference.
Yeah. I wonder with Zoe if her treats were more protein and fat based, that it would stay with her longer. And then if she had more exercise, she would be less likely to have the anxiety to go to the refrigerator and want treats. Now, of course, we don't know everything about Zoe, but it's just a suggestion, because I know that that exercise is so key to getting dogs' minds off of stuff that's going on in the day. And so we have it. Have you seen an increase in anxiety in dogs in your years of being a veterinarian?
You mean over the last year? Yes.
Yeah.
I've seen an increase in anxiety across the board.
Yeah.
And it's not, I don't think it's a coincidence that, because we know that our animals are a reflection. They take in our energy too.
Yeah.
And there's a lot of bonding and people being home with their animals. I don't know if you feel that this way too.
Definitely.
Right?
Yeah.
Like, there's been so much closeness that then when the humans leave, I think that there's a lot of animals that are having a harder time with that, because they actually, became very even more attached. So I have seen that actually a lot over the last year. Yes.
Yeah. Anxiety is I think your busiest day of the year should be on July 4th I think you should stay open late. And I think all the dogs in Orange County should go have a big giant pool party on the 4th of July until the fireworks go off. And I think if everybody swam that day, especially in the area you guys are in, I mean, that area is like the loudest 4th of July area I've ever heard in my life. Sounds like the world is ending down there. But I would imagine pets who are suffering from anxiety, whether it's situational or it's like kind of a constant, they would, that's when I was saying, like, I know we think about rehab facilities as bone injuries or, being hit by a car or torn ACLs, but I think that your facility provides so much more. And so anxiety is one of them. Have you had anybody just use your facility for a dog with anxiety?
Yeah, we actually had it's a pit bull. His name's Creature. And he was crazy on the leash, just, riddled with anxiety. And so he actually, I don't know if I can say this, but he used some CBD oil, and then he also swam with us twice a week. And and nutrition changed as well. And between the three of those, it changed his life and changed his pet owner's life, because now he walks on the leash. He's more calm.
And he lost weight.
He lost weight.
Great.
Yeah, I think that our animal shelters are filled with animals whose pet owners have given up with dealing with poor behaviors that a lot of time stem from poor diets, not enough of the right kind of exercise. People think, well, I have a big backyard and he paces by the fence all day long. That's not exercise, that's anxiety. And that's horrible. Yeah. So I really love the idea of sending clients to you who have these pets, who have this kind of chronic anxiety that's just with them. Mom went to, especially now that people are going back to work, right? We're seeing this tremendous amount of anxiety. And just, I know when I took Nevada down there. So for those of you who are listening and don't know, my dog's name is Nevada. She's a golden retriever. And I joked that she wouldn't go swimming because she's afraid of the water when I take her to the beach. Turns out she did swim. But my whole point to all of this, she wasn't a very good swimmer. Lourdes told me that my dog wasn't a good swimmer.
I did not say that.
I said, is she a great swimmer? Is she the best swimmer you've ever seen? And I forget what you said. Do you remember what you said? You said, something along the lines of she needs to practice or something. But to be fair, she was the worst swimmer I've ever seen. She couldn't even doggy paddle. It was embarrassing. I'm like, this is a golden retriever, for God's sake. And she just like, plop, plop, plop. Thank God you put the little life vest on her. And I have a video, but she learned it very quickly. But my point is, Nevada doesn't have anxiety. She doesn't have any medical problems, anything at all. I just took her down there to check your facility out before I put you on the podcast and stuff. That pool swim lasted 2 days on my dog. 2 days. I was like, are you okay? She was so calm for 2 days that even she's addicted to balls. She's a golden retriever, so she has to have something in her mouth all the time. And even after that swim, like, she still wanted to play ball, don't get me wrong. But it wasn't that out of control, got to get the ball, don't know what else to do with myself. It was kind of like, cool, we're going to go play ball. And I was like, wow, I need to take her swimming more, because it lasted for a while, which is why I wanted to talk about anxiety with you two, with three of you, because from my experience, like I told you, I've worked with animals for 37 years, and anxiety didn't used to exist. I know that people that haven't been in this long, we didn't see this in animals like we see it today. It is horrible. We didn't have animal. The only time we saw animals with anxiety was 4th of July. People would come in, they'd get their acepromazine, we'd give them that. They'd go home, they'd drug their dog, and that was that. Now it's on a daily, like, I have these dogs with this horrible, horrible anxiety. So I'm hoping that the people that are listening and we're educating right now will also know that although we call this, you guys call it a wellness center, which I think is the perfect name. It's not just a rehab. It's all encompassing about wellness. So what else? We can probably help with anxiety. Barb, tell me a little bit how, so I get there. I'm going to bring my anxiety dog in, let's say. Walk us through how that's going to look.
So one would call our main number, and I typically answer the phone, and I would find out a little bit of information about the pet parent, the dog specifically. We'd find out what veterinarians they've been to, or specialty vets, so that we could call and get medical records. We would make an appointment, and they would come in with their dog, and we'd get them on the scale, weigh them, and then we'd get them in for an evaluation with one of the veterinarians. And then during that evaluation, the doctor will evaluate the dog for its current state and condition, and then make a recommendation based on the mutual needs for the dog. Whatever the pet parent's looking for, whatever the veterinarian sees that is a need. A lot of times the veterinarian discovers something during the evaluation that maybe the pet parent didn't know about before, or just might have been, overlooked from, another primary veterinarian. So it's a pretty thorough examination, and then that's kind of where it goes from there. And then based on what the recommendation is, then we have packages for most of our services here.
So just so people, if they're visualizing this, so if I go there with my dog, either whether it's a case like Nevada where I'm just bringing her there to swim, or it's a case where we've got some work we need to do for rehab, does the owner have to get in the pool? I get asked that all the time.
No.
Yeah.
No, the owner does not. They witness. They are the spectator. They're the cheerleader. They cheer their dog on.
They get to watch, take pictures, video. All of our swims are assisted, so the dog is never, alone in the pool. We make sure that we gently walk them in if needed. We'll put a life vest on them. but eventually like to get, graduate them off the life vest. So
So
every
many,
dog is different.
so many people say, I will do it, but I'm not getting in the pool. I've heard that. So I wanted to make sure people knew that what you had said, Lourdes, is it's always assisted by one of you, correct?
Yep, there's always somebody in the pool with the dog. Absolutely.
And then are there a lot of dogs in the pool at one time?
No, typically it's, well, if they're housemates, so we've got, 2 dogs that live together, they're litter mates, so they swim together. We have had maybe a dog that maybe plays with another dog, so we've asked the pet parents, and as long as we have 2 swim techs in the swimming pool to manage it, then we can have 2 dogs. But typically, most of our swims are therapy swims, so they're assisted one-on-one with the dog. And I can tell you, I'll just add, so many people that come here, and the vets will suggest getting them in the swimming pool, and they're like, oh, I don't know if my dog's gonna like it. I'm not, they've never swam before. And I love this story. There's a big German Shepherd that comes and swims here. He was here today, and he gets acupuncture, laser, and chiropractic. And every time he comes here, so he came here for his evaluation, and his mom, we take him in the back, and she's like, I don't know if he's gonna like this, and we can't get him out of the pool. He's this 115-pound German Shepherd. His name is Hank. Every time he comes here, he can't sit still in acupuncture because all he wants to do is get to the back door there so that he can go swimming and play with his squeaky chicken. And he loves it.
Squeaky chicken. That's how we got Nevada in the pool. One little squeak of and she was like, forgot there was even water around her.
Yeah.
And
that's a dog that had never swam in a swimming pool before, and we can't get him out of there. So
that's amazing. Nevada did
one story.
Yeah, Nevada didn't want to get out. Like we had to force her to get out. So I was pleased to see that. So I have a question that says, does acupuncture hurt them?
That's an interesting question. Typically, no. In Chinese medicine, there are, we refer to certain reactions as a good thing. Sometimes there's something called Tai Chi, and there are areas, if energy is blocked or if energy has a stagnation, we'll call it, right? There's an issue somewhere and it's not allowing the appropriate energy to get to that area. That's usually when we start to have pain or weakness or some dysfunction. And sometimes when we put a needle in a certain spot, it might be a little bit like, whoa, I felt that. Typically, no, it doesn't cause pain when it's done correctly. But there can be some points that we say are a little spicy. And that's usually because energy is not getting to that area, which is why they need that needle, right? Yeah. They need the needle because we're trying to pull the energy past that stagnation point or multiple points. So it's usually very comfortable. They usually fall asleep, or they just sit there. There are some dogs that are a little squirmy, some kitty cats, that until they understand what we're doing, they're kind of like, what's happening here? But usually we're able to do acupuncture and they're just kind of lying there, and sometimes they just fall asleep.
Do you guys have an acupuncture needle around that you could show everybody? I think a lot of times when people think, especially when we're talking about, veterinarian and medical stuff, they think needle. Okay. And maybe we're going to show you guys a little needle, and maybe that'll help you kind of, I know it can be really scary, especially our babies and our fur babies. Then the word needle just makes our heart hurt. Like we're going to be sticking.
Sometimes, I mean, I've watched the vets, administer the needles, and sometimes the dogs don't even feel it. They don't even seem fazed by it.
Yeah.
Certain acupuncture, the acupuncture points are special points. The tissue there is not like the surrounding tissue. It's not just like putting a needle into the body anywhere. The points are actually, the tissue is different. And so, when you put it in you're putting me in the center. Okay. So this is, I don't know if you can see this. Where are we? Where's the thing? So this is a tiny lip. Do you see how tiny that is? So this is a small needle, and we use this on the feet or a
Right.
kitty cat or a small dog, and then there are different areas of the body that have, for a larger animal, areas that are more fleshy. I might use something a little bit bigger so you can see that.
Yeah.
But they're like hair-like. They're
Okay.
not like a needle, like a syringe or something.
Yeah.
They're hair-like. And most of them, I mean, I sometimes do it on myself. And you don't really feel it. It's really not. It's very enjoyable. I mean,
Yeah.
and a lot of people love it because they feel so relaxed. They love getting acupuncture. So
Like, one of the things I love about dogs and cats and acupuncture, and we kind of touched on it before, is that, you get people who just think, oh, acupuncture, that's not going to work. That's just a bunch of hoopla and whatever. But when you have an animal, like we talked about, they don't have the placebo effect. If I take an animal in and get acupuncture and he was limping when he came in and he's less limping when he walked out, that's why I believe in this so much, is because of animals.
Yeah.
It's very easy when like your friend or your, somebody down the street says acupuncture worked for me. And if you don't believe it, you're going to be like, yeah, she's crazy. But with animals, it really helps us. That's why it's so amazing when you see this. And every time I speak with a veterinarian who has gone from being a conventional veterinarian, and all veterinarians, by the way, that are licensed in the United States are conventional veterinarians who learned how to be holistic or homeopathic or whatever, which a lot of people don't realize that. They just think you got this holistic veterinarian and you have this conventional, but all holistic veterinarians went to school to be a veterinarian.
Yeah, we have the same training. Yeah.
And everyone that I've ever had a conversation with has said the reason they became holistic or homeopathic is because they watched an animal get better. And it changed their life. It changed how they started to treat animals, as they watched these animals that couldn't get better through conventional only, and were able to get better through something like ozone or acupuncture. And so it's pretty amazing to watch, not only for the animals, but for the veterinarians. When you see a veterinarian just go, oh my gosh, this is amazing to watch. Because that's, I think, all veterinarians, there's not a veterinarian on the planet that went to vet school because they didn't care. Like, I don't even like animals. I'm going to go through all this school and pay all this money and not make very much money.
It's not the goal.
I don't know any vets like that. So to see these veterinarians change and grow and the animals getting better. I got out of veterinary. I was a tech. I got away from it because I was tired of watching animals not heal.
Yeah. And
it broke my heart. And but holistic veterinary medicine was in its infancy back in those days. We're going back 25 years. Nutrition only came in a bag, and it was brown and it was poured out of a bag. That's what nutrition was back in my day. So seeing this it just warms my heart. But I have some questions for you. Not from me. They're from other people. So I could ask you guys questions all day. Can you describe what aquatic conditioning is?
Aquatic conditioning.
I think it's on your website.
Oh, do you mean cardiovascular fitness?
Yeah.
It's just fitness, that we're using the water very gently and in a controlled environment with the buoyancy of the water to become more cardiovascularly fit. So we're conditioning the body through water, whether it's the pool. We have an underwater treadmill here as well.
So it's like going to an aerobics class.
Yeah.
But it's using water to do it.
Yeah.
Water aerobics, I guess.
Okay, so I am just visualizing, Richard Simmons. I feel like we need a Richard Simmons day where, he comes out and he leads the class, and you have like 12 dogs doing synchronized aquatic conditioning. Let me know if we could put that together. I'll sign my dog up. That's amazing. But so many animals sit on the couch all day long.
And if they have arthritis, or they have something that's causing them, making it difficult or painful to walk. Yeah. A lot of dogs decide not to.
Yeah.
For some dogs, they know that getting on their feet is going to be painful.
Yeah.
And what's amazing about pool is that when you don't have to put weight through your joints and you can start swimming around and flying around the pool, you're mobile and you're just gliding around, and there's so much freedom there, you know, that I'm getting them moving again. So that's what we mean by aquatic conditioning, especially for those guys that are being couch potatoes because they really don't want to walk very far.
Yeah. Yeah. And what's so important about, I would say, the conditioning is going back to nutrition and the connection. I do nutrition all the time. It's one of the things I do the most. People will come to me and they want to put their dogs, their couch potato. Let's use a bulldog, for example. They've got their old English bulldog and he's overweight. And they're like, well, I'm just going to change his diet. And I'm going to put him on this high fat, high protein diet. Well, no, you're not, because if he's going to eat that much protein and that much fat, he needs to exercise. Yeah. So they have, you know, and equally, I would imagine, right, if we have a dog who's going to start exercising, we have to change his diet to match that exercise. So that's why in combination is so important, right? And that's why you guys did such a great job of combining those two things. Otherwise, people would walk out of your place and go, he's getting all this exercise and not eating the right diet. And they really just need to go together. So aquatic conditioning, I love the sound of that.
Yes.
It's amazing. It's amazing. Tell us a little bit about the underwater treadmill and the difference between the pool and the underwater treadmill and why you would use one without the other, or how you would use them in conjunction.
The underwater treadmill is when you're literally walking into sort of a box that has a moving belt. Dogs walk in, and cats. I've seen cats do pretty well in there as well, by the way. Basically, there's no water when they walk into this glass box. You know, their parents are standing right there. Lourdes is right there. You know, it's really a very pleasant. And then water comes up while they're standing in there, and then this belt underneath them starts moving. So it's literally a treadmill where the buoyancy of the water is helping support their weight. And what we use that for is very different from the pool. It's different. I mean, there's some dogs that can certainly do both and benefit from both. But the underwater treadmill is actually when we're trying to get them to bear weight. And so that's you know, the distinction. We want, in some cases anyway, we want to start building muscle through weight bearing, like an animal that's coming out of a TPLO surgery or something like that, where we have to go very slowly in weight bearing and build muscle gradually, but we want to put weight through that bone. So that's when we're using it. And also it's very good for neural re-education. We're trying to pattern their gait. Some animals that are having neurologic problems are having trouble walking. And we actually go in there and start to re-educate their nervous system so that they can learn how to walk again. So that's the underwater treadmill. And then swimming, you know, is movement and cardiovascular fitness and joy. And it's a little different. And there are some cases where it's, you know, they're coming in for fitness and they're coming in for weight loss, which can be used, I think, both, right? But there are some cases where we might not want to put weight through that joint. There are some situations where we might not want to get them, you know, standing on leg yet. Maybe they just had surgery and we're not ready to start doing an active therapy where we're putting weight through the knee, for example. So it's a little different. One is weight bearing and one is not.
That's brilliant. I didn't really understand that before. That's brilliant because, yeah, and you can control it.
Yes, always.
Right. So you can control, does that mean that like over time you would be reducing the water and creating more?
Yes. So we start out at a certain level, and then we can get it to, as they're becoming stronger and more fit, right? Then we start to reduce the water level. We can start to speed it up also. And so we are making them get stronger, but we start at a certain place, and that's our starting point. And then we start, you know, the process of you know, building that muscle, of patterning that gait. So yes, like that's, you know, once we are able to get them to progress, you know, it's not just the same thing all the time. So yes, we get them stronger in there.
Have you guys ever done people in there?
Well, I was in there today only because I was supporting a dog.
Yeah.
But I wasn't on the actual belt part. I was standing off to the side. So.
I'm like, I wonder if I could get my dad, who desperately needs to get some exercise.
But I do know that the treadmill company that we use makes one for humans
Yeah,
too.
They do.
There are some PTs that have human and they're vertical.
Yeah.
So rather than being, like a quadruped, so that it's, it's wider, it's actually something that people stand in. And it's great. I think it must be great.
Yeah.
Yeah. I would imagine it would.
We might have to try it ourselves.
So interesting. I love it. Someone says, so interesting. I love it. So I would imagine if you have an animal, in case anyone's listening and they think like I did, which I really thought Nevada would not get in that water. I was convinced. I was betting my friend. So I was, convinced she wouldn't get in the water, my golden retriever. But I would have imagine you could use the underwater treadmill if you had a dog who is deathly afraid of the pool, since you said they walk in it and then you slowly increase the water. So that could be another option if someone's listening right now and they're thinking, listen, there's no way my dog's getting in the water.
Yeah.
Right. And then you could.
We've had that. We've had dogs that will not get in. Well, one particular that I can think of, and he's been coming in and getting in the underwater treadmill, and he's doing amazing.
Yeah. Well, you guys have been so informative and so great. I know we're at a little after 6, so I'm going to let you guys kind of go. But can you tell us really quick, just give me your information, your website information for both of you guys, and so Lori can type it out for everybody.
Yep. So you can find us, Animal Wellness Center of OC. You can find us Instagram, Animal Wellness OC, our Facebook page, Animal Wellness OC. You can look us up at www.animalwellnessoc.com. Our phone number is 949-534-4654. And Dr. Voulgaris, I don't know if
I don't really have. You can contact me here. I have an Instagram page. It's called Petucate You.
What is it?
Petucate You.
Petucate,
but Petucate. P-E-T.
Oh. He does it all with a swag. Okay.
It's just where I, contact me.
That's awesome.
He has a podcast as well.
I was just gonna say, please tell us about your podcast.
Oh gosh, it's under the Petucate You umbrella. I don't know. It's very complicated. Actually, Petucate You is the sponsor for. It's called Vet in the City.
Vet in the City? Oh, that's a cute name. That's an easy name to remember. Vet in the City.
Yeah, I'm from New York, so it's the whole, Sex in the City thing.
I love it. That's a great name.
Oh, yeah, thanks.
That's a really great name. So hopefully our listeners will tune in and, get some information there. Anything else you guys want to add that you think is super important to know about the Wellness Center that maybe we missed?
We're here in Costa Mesa, California, and we're open 6 days a week. And give us a call.
Yeah, we'd love to meet you, your pets, and keep them healthy.
Yeah. All right, guys, I'm going to go ahead. Oh, hang on one second. Real quick. Yeah, so Sari is saying that she's very concerned that if she teaches her dog how to swim, then if they're not home, they might go into the pool when they're not there. But I would say, I'm just going to take this for a second, at least she'd know how to get out. You might want to teach them, right? So that they can learn how to get out and that kind of thing. So
absolutely. Yep.
But yeah, it might actually, that's a whole nother thing. You guys could probably reach out to people who have pools and teach their dogs how to swim.
I think that.
Yep.
You do?
Yep, we do that. And so they at least learn how to swim in the water, and then they're comfortable in the water. Then when they get home and their parents get them in the pool, they just show them how, where the steps are and how to get out of the pool.
I know I'm keeping you guys longer, but I was a little girl, but I had a dog drown in a pool, literally. It was horrible. And so, for anybody who has a pool, I would encourage you to go and let them train your dog how to find stairs and how to get out and, what to do in case of an emergency, because I can tell you from experience, not all dogs know how to swim just because they're dogs. I think Nevada would have drowned without that jacket. Like I do.
Oh. I think she deserved more credit. She did pretty good.
I love her. I do, but that was embarrassing. So she's a golden retriever, and I just remember like the bottom half of her just went like that. So she's straight up and down, just kind of trying. I don't know what it was.
Dog paddling.
That wasn't dog paddling. That was I'm gonna go under. And, yeah. So I can attest to the fact that not all dogs can swim, and so I think this is another really valuable thing that you guys offer, because you don't have to have. I want to point out, you don't have to have a sick dog. You don't have to have an overweight dog. You don't have to have a dog with anything to just come in this pool, right?
Yep, it can be a healthy dog, a puppy.
Yeah,
absolutely.
And if for no other reason, I think you should just go and at least check this place out in case you ever end up in a situation where you might need some help. You'll build relationships with people that can help you. So I'm going to go ahead and let you go. It looks like what is the doctor's IG page? Oh, Instagram. Sorry. I'm like, what's IG?
I don't know. It's Petucate You. So it's spelled Petucate, Petucate You. Or you can just go to Debra Voulgaris. I have another page on Instagram too. Feel free to follow me.
Okay.
Both. Yeah.
Or you can just come see her here.
Come here.
Yeah. Call us and we'll book an appointment so you can see her.
Yeah, absolutely. And we'll put all the information so that you guys can reach the doctor, and you can reach Lourdes, and you can reach Barb. Everything will be Lori's already typing it up here, so it's all there. So I'm going to go ahead and let you guys go. Thank you so much for being here, and just being willing to, talk to people and let them know who you guys are and that you're available there. Because so like you found out, Lourdes, what do you do when you're in this situation and you had to panic and try to figure it out and drive all the way to Torrance and now, so this is why I wanted to do this, so that people have their resources available to them. So thank you so much.
Thank you for having us.
Yeah, thank you for having us. Awesome.
We'll bring Nevada back.
I will. She needs to learn how to swim.
Maybe you should get in the pool with him.
I'm telling you guys, call me. I will get in the pool. I want to get in the pool with Pepper. I want to I love Pepper. She's like she's been coming to me since she was a baby. So, but I'm telling you, I want to get in the pool with these dogs. I'm going to quit my job and I've always wanted to be like in San Diego. I wanted to be the killer whale person in the wetsuit, and so this is the closest I'm gonna get. But if I show up in a wetsuit that says SeaWorld, don't get mad. All right, you guys.
Thank you.
Bye, everybody.
Bye.